Hello everyone, I am urologist Omar Makaya. We will have a short video today about prostate enlargement and herbal extracts or herbal medicines. One of our patients asked, do herbal medicines or extracts shrink the prostate? Friends, among herbal extracts, the most widely used in the world is saw palmetto extract. Saw palmetto extract has been used for about 200 years. It is the only herbal extract included in the treatment guidelines of the European Urological Association. At the same time, it is the subject of the most research on prostate among herbal extracts. The last time it was around 5 or 600s. It is probably close to 1,000 now. It is the extract with the most scientific publications. It is also one of the herbal extracts accepted by the Ministry of Health of the Republic of Turkey. Because the Ministry of Health, not the Ministry of Agriculture, accepts a very limited number of herbal extracts. From a rational point of view, of course it makes the most sense to use the extract of saw palmetto. What are its effects? It can reduce the prostate volume of patients. It can be good for patients' complaints about prostate and prostate enlargement. Of course, this extract differs from each other. For example, there can be 70%, 45% extracts. These are different from each other in price. Generally, some companies put 45% extract, some 70% extract in the product. This saw palmetto was within the scope of SSI payment in the early 2000s. Obviously, we were prescribing it a lot. Patients could take it free of charge. In the polyclinic environment, we saw with our own eyes that this saw palmetto extract really benefited the patients at that time. It was especially beneficial in patients with mild and moderate complaints. Of course, the possibility of benefit was slightly less in patients with severe complaints. Later, it was covered by this payment, but the company withdrew the product from the market because product costs increased. Then, when such a demand came from patients, we gradually launched a product containing saw palmetto 5 years ago in 2018. It will be a bit commercial, but it is called Sawprost. We also put saw palmetto, lycopene, pumpkin seed and nettle extracts in it. Nettle and pumpkin seed extracts are also very effective in prostate-related complaints. We have been giving this to patients for about 5 years. We have not seen any serious side effects in patients, except for a few patients reporting elevated blood pressure as a side effect. Side effects are one of the biggest reasons why patients want herbal, why they do not want chemicals. Now what are our weapons in chemicals? Drugs we call alpha blockers, such as Zatril, Zalfu, Cardura, Flomax, Tamprost. These reduce the pressure of the area we call the bladder neck. It relieves the bladder neck. It relieves the patient's urination. But it is not a drug that provides a volume loss in the prostate. And the effectiveness of the drug is around 3 to 4 days. If the user does not continue to take the drug 3 or 4 days after taking it, there is no effectiveness of the drug. But it relieves the patient while using it. However, it has such side effects. For example, it can cause dry ejaculation or a decrease in the amount of semen or dizziness when the patient stands up, or muscle pain, or sexual complaints. One of the other weapons we use in prostate disease is 5-alpha reductase inhibitors such as Avodart, Dutaprost, Proscar. These drugs make hormonal changes and cause a reduction in the volume of the prostate and a decrease in the blood supply to the prostate. The most common side effects we see in these are sexual dysfunctions. Now, we generally try not to give these 5-alpha reductase inhibitors to patients in their 60s who have not stopped sexuality and whose sexual power has weakened somewhat. But let's say, for example, if the patient does not want dry ejaculation or does not want dizziness when he stands up, if he has mild complaints, we can start with herbal treatments. We then follow up the patient. As a result, we look at whether the patient's complaints are increasing or decreasing. In BPH patients, we monitor whether there is an improvement in prostate cancer. If the patient's condition worsens, we can apply drug combinations, we can give herbs and chemicals or these two chemicals in combination with each other. Or we can give Cialis, which is a PDE5 inhibitor with the active ingredient tadalafil, both to improve sexual functions and to improve prostate-related complaints, in low doses in the long term. In addition, one of the most widely used herbs for the prostate in Turkey is fireweed herb, which is sold in herbalists. Patients can also use this and benefit from it. In general, herbal extracts in this way. When you use a herbal extract, especially for the prostate, you should not expect the well-being to be before 15 days or 1 month. So, for example, for sexuality, they put a herbal product on the market, they put Viagra in it, you take it, you see the effect of the herbal after half an hour. You are generally not likely to see such fast results in herbal medicines, friends. So when using these saw palmetto extracts, it is necessary to keep your expectations a little low, because it does not work immediately. It does not work within a few days like alpha blocker drugs. You need to wait at least 15 days to 1 month for it to take effect. Thank you for listening, best regards.